Hi, everybody. Today at Miyara Health, we are in conversation with Dr. Ruchi Bhandari. She will be talking to us about adolescent health, pre-conceiving and pre-pregnancy care, and infertility issues. Briefly about Dr. Ruchi Bhandari, she is the director and owner of Mishka IVF Center, Jaipur. She's an infertility specialist trained from Chennai, and she has an MS in OBGYN from Pune, a gold medalist at that. She is an active member of many international and national infertility societies. Being a fitness enthusiast herself, she has special interest in treating PCOD, lifestyle disorders, hormonal imbalances, and adolescent health issues. She has an expertise in treating basic infertility with lifestyle and diet modifications. And the advanced and complex infertile couples are treated with the best fertility solutions like IUI, IVF, laser hatching, and blastocyst transfer. And she excels in hysteroscopic and laparoscopic surgeries in infertility. Welcome, Ruchi, Dr. Ruchi. Let's begin with the adolescent health issues. And the first question would be, when is the first time you should take your daughter to a gynecologist? And what will they check when you go to the doctor?
Yes. These days, because of the awareness, yes, girls are taken to the gynecologist a little less often than they should be taken to, and the guidelines suggest that between the age of 13 to 15 years, you have to go for a general checkup. Why there are three things that should be remembered is we give you an information, we give you prevention, we give you treatment. So these are the three things for which you have to come to us. So what kind of information would you want? So what a girl who is going to enter her teenage, or she's going to go to high school, she has a lot of doubts in her mind for sexual health, her sexuality, whether her secondary sexual characters have been growing well or not. So she has a lot of which parents cannot generally answer to, or maybe they are not very comfortable. So we can give a basic information on this for secret questions that they might have in the mind, because the technology Google is flooding with information. So to get a specific information, they can access the gynecologist. Prevention, so we can prevent them from getting pregnant, from sexually transmitted diseases, and from lifestyle disorders. So these days there are a lot of gynecological issues because of lifestyle changes, like polycystic ovarian disease. And treatment, when it comes to treatment, so they might just think that it's a minimal pelvic pain or a stomach pain, which could be due to bloating or gas, or they might think that not getting menses till 13 years of age or 15 years of age is okay. But there are some things that the gynecologist can pick up from the first visit. So any abnormality in the child can be diagnosed and treated, and we can provide you with a lot of there is something called primary amenorrhea, which I would just like to tell everyone who is going to listen to this. So when your child does not get her periods till the age of 15 years, but you think her secondary sexual characteristics have been developed the way they should be, in spite of that, till the age of 15 years, she has not attained her menarche, or the periods have not come, you must show a gynecologist, no one else, no family physician, no pediatrician. But by the age of 13 years, the child has to enter puberty. She has to start showing her secondary sexual characteristics. So no secondary sexual characteristics by the age of 13 years, no menses by the age of 13 years, then you have to go at 13 years to your gynecologist. So these are some of the things that a parent should remember and should know before taking the child to a gynecologist.
As soon as they have their first menses, should they be visiting the gynecologist at that point? Not
So,
necessary. Okay.
not necessary.
Okay.
Any time between 13 years, then.
Okay. Yeah. And is there any information the parents should talk to their children about before visiting a gynecologist or?
One talk between the parent and the child has to be if you are comfortable in going to somebody known or you want to go to somebody discreet, somebody unknown. And do you want a male or a female gynecologist? Do you want you to talk to your family physician first and then get guided to a gynecologist? Do you want to see your pediatrician? Are you comfortable? So a one-on-one talk is important as to what the child is comfortable with is important, and then proceed to going to a gynecologist if needed. Sometimes it's not needed. Sometimes you get all the information from your family physician, which is okay. Second, very important is that sometimes if you're going to a male gynecologist whom you know or you have been referred to, there are some do's and don'ts that you must remember is a doctor. Yeah, so when there is a general examination, she should be told that these are the things that will happen over there. So once the child is prepared mentally, it will be easier for her to visit. So first what we do is we do a general examination. We take the height, the BMI if it's appropriate for the age. We do a general examination of the pulse, the heart, the lungs. We see the stomach overall. We do a general examination of the child, pallor, if there is a less hemoglobin, or if her conjunctiva is yellow, or just a general examination if she. So from general examination, we get a clue of many diseases. Second is a specific examination for her secondary sexual characteristics. So when you're saying that I have got my adolescent for a checkup, we have to do this. We have to do a breast examination. We have to check for axillary hair. We have to see if there are any scars, any boils, any pigmentations that can help us to get to a conclusion to anything that she may be suffering. And a local examination or a pelvic examination or a vaginal examination is generally not done unless she is having primary amenorrhea, that is, she has not attained her menses, but then she feels there is a lump down there. So sometimes what happens, because there is a blockage outside, the hymen is closed or it's imperforated, the menstrual blood does not come out. So this is a condition, and it's not as uncommon as we seem, but it is pretty common. So for that, for very few selective symptoms, we do a pelvic examination. Otherwise, it's not done generally in adolescent kids. So every time, just tell her that if you're going to a gynecologist, no doctor is allowed or no doctor is there to judge you from looking at your body. No one is going to judge you. So we have to just tell her, because kids are a little skeptical about this. And yes, no one is going to examine you unless and until it is required. And if there is a male gynecologist, there should always be the parent or a nurse standing there while the girl is being examined. So this is something that has to be done. Yes.
Yeah, that's a good point. Going on to the next step from this adolescence. So you said that you go for a checkup and you don't have your menarche, and then you need to get it checked, and then you follow the doctor's instructions from there. But now the child is normal. She's got a menarche. She's got her menses. She's doing fine. And then there's a point when you need to talk about sexual activity, or the person has grown up and they want to discuss this. So how do they go about it at that point? What do they do at that point?
Yes. So any girl who comes to me regarding the onset of sexual health or sexual activity, so I want to tell them, please educate yourself enough before you enter this phase, right? Hormones are act upon you and you are going to be sexually active, but we need to understand that women have to take care of themselves more than men do, and that's a fact. We cannot ignore it. Sexually transmitted diseases STD does not just mean HIV or just hepatitis B.
That's true.
we have about 12 to 15 viruses that cause sexually transmitted diseases, and which can lead to later on infertility in your life. Just a little fun can lead you to being permanently infertile. That is, your tubes can be permanently blocked, could have to be removed. You can have cervical cancer. I'm not scaring anybody over here, nobody. Okay,
Yeah.
because it is a right to be sexually active, but please be informed well from a proper source. Source is not Google, because Google can tell you anything and everything. So everything about sexually transmitted diseases, I can sit and talk about it for about 2 hours, because there are so many diseases. But if somebody wants, go to a gynecologist, talk about it. You should know if your partner is having a certain infection. Suppose he is suffering from herpes. So what are the signs that you can look for? The scars, the blisters, the erosions. Can you look for something that can prevent you from having herpes? It is important that if you get a certain kind of sexually transmitted disease, yes, we have treatments for it, but you can be a lifetime carrier of it. So it's very important to stay away from STDs. The only good way of prevention is condoms, barrier contraceptive. There is nothing more than that. Second is an HPV vaccine,
Okay.
a human papilloma virus vaccine. Everybody, you and I, we have been infected by HPV. HPV has 40 subtypes, so we all are infected by it. So to prevent from the sequelae of HPV, which is cervical cancer or genital warts, so scientists have come up with this vaccine which can prevent from getting cervical cancer in later half of your life. And cervical cancer is the second most common cancer in women after breast cancer. So HPV vaccine, it plays a very big role in our life. And it should be taken. So now there are just 2 doses for girls who are between 11 to 12 years.
Okay.
After 14 to 21 years, there are 3 shots that are to be taken. So if there are 2 shots that are to be taken in 11 to 12 years, it should be at an interval of 6 to 12 months.
Okay.
But the 3 shots is given at 136, and that's how it's given from 14 to 21 years. It's important that you take these shots before you are sexually active. Once you are sexually active, you are already exposed to the virus, and so the potency of this HPV vaccine reduces. But that does not mean that maybe at 32 I just got aware of this vaccine. You still take it.
Okay.
It's not going to harm you. You still take it whenever you are aware of it. But yes, remember that it's going to be less potent. So be more aware of not risking yourself to STD. Third, there are a lot of things that I want to discuss actually on this, like
Sure,
what
go on.
I I speak to an adolescent. Yeah. So then you should know how to prevent pregnancy, because you do not want to get pregnant. And for that, you must understand how your menstrual cycle works. What are the days when you are maximally fertile? And that is supposed to be known to you. You are a woman, you have to take care of yourself. And multiple sexual partners. If you have multiple sexual partners, you are more at risk of getting STDs. These viruses, they just do not infect your vagina. They infect your vagina, your vulva, your oropharynx, your oropharynx, your mouth, and your anus. So this is all that is going to be infected. So it is important that either you take a test of STD. Second, avoid multiple partners. So every time you think you have to change a partner, please get yourself an STD test. It's easy to get a test. Please do it. Also, there were a lot of things that I had to do. Yes, pap smears. So once you're sexually and after 21 years, every 3 years get pap smears. Pap smear is nothing but we just scrape the cervix and we take the cells and we check for any kind of infection or malignancy, that is
Yes.
cancer. So these are some few things that you need to understand before the girl gets sexually active. It is very important. Yeah, I think
You've
that's
covered,
it.
you've covered a lot of points. In fact, these were things that some of the Insta followers asked, what is the regular health examination required from puberty onwards? So I think you've covered a lot of those points. Um, and one more question in this regard is birth control pills and contraception. So other, you had mentioned condoms, which is one of the main ways. But is there anything else that they need to know before they start birth control pills? How are they? What is the deal with that?
Okay, so my advice for young girls before they are married, just use
Mhm.
condoms always. Because what happens is if a girl is on birth control pills
Mhm.
and she thinks that she might not get pregnant, but if she has unprotected sex, she is at high risk of STD. So I would never ever advise a young girl to go on OC pills unless she has a permanent long-standing partner. Yes, you can go on OC pills with so we have these newer drugs with very low hormones, like very low estrogen and progesterone. OC pills are of these hormones. So go on something, I mean, ask a gynecologist as to what OC pills am I supposed to take according to my body type, my BMI. So if the girl has PCOD, then there are some combinations that will help both in contraception as well as it will control your PCOD. So I really don't prescribe OC pills to girls for contraception at all, because
Okay.
then they think that it's okay to have unprotected sex. And remember, it's never okay to have unprotected sex.
That's really good advice.
Yeah.
um,
And then a lot of girls, they come and they say, we want to get an intrauterine device. So intrauterine devices again are going to expose you to multiple infections. Intrauterine device, I don't even advise for girls who are married and do not have any child. We only give intrauterine devices once you have a child, and then you want a gap for your next child. So
yeah.
intrauterine devices, I think unmarried girls must avoid. It causes infections, it causes menorrhagia, excessive bleeding during periods. And then again, you have an option of having unprotected sex. So no intrauterine devices, no OC pills to young girls, just barrier contraceptives. That's it. Just condoms.
Yes, that's a good point. Um, what about
So
irregular periods? Where what is the what are the reasons for irregular periods, and is it a cause of concern? When do they go to the
yes.
doctor?
So when do you know that you have irregular periods? When it is not regular.
Mhm.
So anything, any cycle between 24 to 30 days plus minus 20 to 20 to 35 days is considered normal. So
Yes.
if it is less than that, or if it is more than that, that is the gap between two periods is less than that or more than that,
Mhm.
then it is considered as irregular. Also the quantity or the amount. If you are bleeding just 80 cp in one cycle, that is 3 days or 5 days, is considered normal. But if you think that suddenly your periods, the flow has increased or decreased, that is also considered as irregular periods.
Okay.
Okay, so anybody who's having periods every 15 days, or anybody who is having periods every 2 months, it is
Mhm.
irregular. Causes of irregular periods are multiple. So
Mhm.
we need to understand that our periods are regulated by our brain, and they release these hormones in shots. So, and that's how estrogen and progesterone is produced, and that's how it's entirely regulated. Anything that
Okay.
is going to disturb our brain is
Mhm.
going to disturb our pain, whether it is excessive amount of stress, lack of sleep. During the pandemic, there almost everyone's having irregular periods now because of all this. And
Right.
yeah,
The side effects that you don't think of.
yes, because of the erratic sleep schedule and a lot of financial and emotional stress. So first thing that affects the woman is her periods. Her periods
Okay.
just go haywire. And then there are various hormones. One is PCOD, which is very common. 1 in 8 women have PCOD. So that is again a hormonal disturbance because of which you get excessive weight gain in a short period or excessive weight loss in a short period is
Yeah.
considered as stress to your body. That again shuts down your brain, and then we do not get our periods.
Okay.
Dieting,
Mm.
suddenly just starving yourself and not feeding your body with enough nutrients. Again, your body is in stress, so
Mm-hmm.
it's shut down, and they say, okay, so no periods now. So don't eat, don't get periods, right? So these are some things for girls to remember. Then comes thyroid imbalances.
Yeah.
There is a hormone called prolactin. So if that is disturbed, then you can have irregular periods. And
Okay.
sometimes after a heavy period,
Mm.
it's possible that for 2 to 3 cycles you do not get your periods. Then you have to get your hormones tested, because when you have an excessive as an excessive bleeding during some
Mm.
it could be considered as a stress. Then pregnancy is the most common, that you don't get your periods. Please check if you're pregnant. And any kind of emergency contraceptive pills. Now emergency contraception means it is a very very high dose of a hormone that is not allowing you to get pregnant at that time. So these emergency contraceptives, what they do is they are going to disturb 1 or 2 cycles. So every time a girl takes her emergency
Okay.
contraceptive, she's already scared that she might get pregnant, and then her periods do not come. So this could be because either you're pregnant, you've not taken the emergency contraceptive on time, or it's because of that contraception that you've not got your periods. So 1 or 2 periods can be delayed.
Okay.
So these are some of the reasons for irregular periods. There are more.
Yeah. So do they need to go to a doctor immediately? At what point? I mean, is it like if you have it for 4, 5 months or consistently, or when do you start
Yeah.
going?
So one episode does not really need or require you to visit a gynecologist. But yes, if it's consistent for 3 or more months, then
Okay.
definitely you are supposed to show a gynecologist. And suppose you do not get 6 months of periods, that
Mm-hmm.
means you have amenorrhea. This is very serious. So then it requires a lot of treatment and diagnosis. So 3 months is enough for it to be consistent, and then you must contact the gynecologist for that.
Okay. That's a good point.